medical expenses can be a significant part of your annual spending budget. We want to help you manage your healthcare dollars without sacrificing the quality of care you deserve. That's why the state of Indiana's medical plans now offer HealthSync, a Tier 1 network of providers who provide quality care at the lowest rates available. Regardless of which medical plan you choose, you can discover a new level of savings with the Tier 1 HealthSync Network. After you choose your plan, you can choose a provider in any of our 3 networks: Tier 1 HealthSync, Tier 2 in-network, and out-of-network. For each tier, the same services are covered. However, you'll have lower out-of-pocket expenses when you choose Tier 1 HealthSync. Of course, you may still choose Tier 2 or out-of-network, but you will have higher out-of-pocket costs. When you choose Tier 1 HealthSync providers, you benefit from the lowest deductible and lowest coinsurance. To learn more about how deductibles and out-of-pocket maximums apply, visit the State Personnel Department's benefits homepage. The lower costs do not reflect the quality of care. In fact, Tier 1 HealthSync is a network of top-performing providers who are committed to offering value-based care, but with lower out-of-pocket costs. Let's look at an example of how claims work across the tiers. Meet Mia, a state employee. Mia visits a Tier 1 HealthSync provider for a non-preventive service and pays $100, which is applied toward both her Tier 1 and Tier 2 deductibles. Next, she sees a Tier 2 provider, which costs $200, again applied toward both her Tier 1 and Tier 2 deductibles. Throughout the year, Mia sees Tier 1 or Tier 2 providers. Her expenses, including labs, prescriptions, and x-rays, apply toward both Tier 1 and Tier 2 deductibles. Mia meets her Tier 1 deductible. Now she only pays 10% when she visits a Tier 1 provider. The 10% Mia pays counts toward her Tier 1 and Tier 2 out-of-pocket maximums. Mia meets her Tier 1 out-of-pocket maximum, so she no longer pays anything when she sees a Tier 1 provider. Since in-network pharmacies are Tier 1 providers, her prescription costs will also be covered in full at that point. Mia has not yet met her Tier 2 out-of-pocket maximum. She will still pay 30% for any claims with a Tier 2 provider. If Mia meets the Tier 2 out-of-pocket maximum, then she'll pay $0 for any additional care received from Tier 2 providers. The last thing to know is how to find a Tier 1 HealthSync provider. Go to anthem.com and click on the Find Care tab. Be sure to log in or create an account if you don't already have one. Then, when you search for a provider, the Anthem system will automatically show the tier for each provider. And with more than 25,000 healthcare providers and 65+ top hospitals throughout Indiana, you should have several options. So, if you're ready to save money without sacrificing quality, then you'll want to consider the Tier 1 HealthSync Network.